Welcome to your Asepsis and Infection Control lecture. So what is infection control? Well, it involves practices designed to reduce and eliminate sources of infection as well as the transmission of those organisms. So let's think about what would put patients at risk for infection. This would be patients with a deficient immune system, those that have had procedures done, those with IVs, anyone with resistant infections, anyone who is sedentary, and it's transferred sometimes from patient to patient, but we'll talk about this in a bit. So the infection cycle is made up of 6 steps. So it's hard to say what the first step is, but let's say it's the infectious agent since you can't have an infection without it. So this could be bacteria, virus, or some kind of a fungus. The pathogen then needs a reservoir in which to live. At some point, the pathogen finds a way to get out of its natural habitat and into another host. There has to be a way that it is carried from one point to another, such as on an object, for instance. The pathogen then finds a portal of entry into the next host. The next host has to be susceptible to infection in order for the pathogen to survive. Then the cycle starts all over again. So you'll notice that between each step is a way to cut the cycle. So be sure to know how to break each step of the cycle, as you may see this again. Okay, so we were going to do a group activity here, but we don't have class today. So you can go ahead and do this assignment on your own. What I want you to do is write down each part of the infection cycle and think of examples of each one. This will help you to answer test questions correctly. So be sure to be specific and be sure to put some time and thought into this. We can discuss it in lab this week if you wish. Okay, there are 4 basic stages of infection according to your Taylor's book. There's the incubation period, the prodromal period, the full stage of illness, and the convalescent stage. So let's talk about each stage. The incubation period is the interval between the pathogen's invasion of the body and the appearance of symptoms of infection. So the organism is growing and multiplying, and the time of the incubation period varies per the organism. So if I were you, I would know the incubation periods for the common cold, the flu, and Lyme disease. Those are 3 that you may, definitely the cold and flu you'll see a lot of. Lyme disease maybe not so much, but it seems to be becoming more prevalent. The prodromal phase is the most infectious stage. So they may have some non-specific symptoms, such as malaise, they just don't feel well, they're tired. But the person is unaware of their illness. And this period can last from several hours to several days. The next stage is the full stage of illness. There are specific signs and symptoms. The type of infection determines the length of illness and the severity of the manifestations. There can be localized symptoms, or there can be systemic symptoms. So that would be through the whole body. The convalescent period is the recovery period from the infection. It varies according to the severity and patient condition. The signs and symptoms disappear during this stage. So let's talk about the factors affecting an organism's potential to produce disease. A greater number of organisms leads to a better attacking of the host and therefore a greater likelihood of producing disease. The virulence is the ability of the pathogen to invade and injure the host, and it depends on the pathogen's DNA and the correct type of host. A person's immune system is a great determiner of whether or not a pathogen can cause disease. For example, those who are immunocompromised would include those with AIDS, those who are frail, the elderly, those in the ICU, because they have a lot of stress on their body. Lastly, a greater length of contact between the person and the microorganism means a greater ability to produce disease. So, how can we prevent the spread of infection? The number one way is through hand washing. Believe it or not, and you're going to hear this over and over. Okay, non-compliance among hospital workers is rampant. It's below 50% compliance. Why? Okay, so the reasons the healthcare workers give are lack of access to sinks, lack of time, skin irritation, ignorance to importance, lack of support, lack of commitment from the institution. And those things all do truly exist. So some important concepts to remember about hand washing. Should be for 15 to 20 seconds. Should involve vigorous scrubbing because that is what gets rid of the germs. Okay, the antibacterial soap doesn't necessarily get rid of the germs. It's the scrubbing and getting under the nails and in between the fingers. There's soap and water. Okay, the soap helps to release those germs from the hands. And we're going to use lukewarm water, not hot. Hot water will scald your skin and break it down, leading you more susceptible to picking up an infection. So lukewarm water. Don't use scalding hot water. That might work on objects. It does not work on hands. Bacterial flora. What is it? Well, this is the bacteria that normally lives on or in the body. There's two types. There's the transient and the resident. Transit you can get rid of by, well, it's attached loosely on the skin, so you can remove it pretty easily. Resident flora is found in the creases in your skin, so it requires some friction with a brush to remove. So this might even be something like under your fingernails. Healthcare acquired infections. Some of you may have heard of these. These are basically infections that a client acquires while receiving care in a healthcare setting. They're also known as nosocomial infections. They come from an exogenous source from outside the body. They're transmitted through contact. So this could be patient to patient, nurse to patient, or even an appliance to the patient. Big ones that we see in the hospital are CAUTIs, catheter-associated urinary tract infections. So this would be from an indwelling catheter such as a Foley. Ventilators are also famous for causing infection for multiple reasons. You'll learn more about that later. So healthcare workers are susceptible due to exposure. You're exposed to a lot of germs in the hospital. Broken skin. Artificial nails are a big one. Artificial nails have been proven to carry some of the worst bacteria, particularly the resistant bacteria. Now gloves protect the nurse and somewhat of the patient, but regular old gloves is mainly to protect the nurse from exposure. The Joint Commission has an initiative called the Speak Up Initiative, and this means speak up if you see someone breaking sterility or doing something that could cause an infection. Resistant infections. Hospitals breed resistant infections. Invasive medical devices are largely to blame for these infections, and this is why we start with the least invasive measures before going to the most invasive measures. And I'm not talking about dignity here. I'm talking about being, so giving a pill versus an IV, if they could be equally efficacious. We're going to start by giving them a pill, and if it doesn't work, then we may go to an injection or an IV, which would be more invasive because it's entering the body in a way that could cause an infection. I hope that makes sense. So, the most common antibiotic-resistant organisms in the hospitals are listed here. So they include MRSA. There's also VRSA, VRSA, CRE, C. diff is a big one, and then Acinetobacter baumannii, Okay, so these are the most prevalent ones that you may see in the hospital, so be aware of those. Okay, since we don't have lecture today, you're going to do this activity on your own. Write down as many groups as you can think of that would be at risk for an infection. So I'm going to end this video here. This will be the end of part 1, and then we will pick up with this same slide for part 2, but this will give you time to write down a list of groups that would be at risk. And you can go to page 88 in your ATI book for this.